Knock, knock, knock. Hi, my name is Nikki. I'm going to be your nurse today. I'm going to provide privacy. Can I get your name and date of birth, please?
Dea, Olnett, 225/04.
Okay, Dea. Do you know where you are today?
Sunnyview,
Sunnyview, yep. And do you know what year it is?
2024.
2024. Okay, do you currently use any narcotics?
No.
Okay, so I'm going to perform a neuro assessment on you. I'm going to be doing a couple things with you and I'm going to ask you a few questions. Is that okay?
Yep.
Okay, so the first thing I'm going to do is I'm going to check her Glasgow coma scale, and I want to get a score of 15. That's the best score that you can get. So for the Glasgow coma scale, I'm first going to check for eye opening. So just visually looking at her, she can open her eyes perfectly. I don't see any eyes that are drooping or anything like that. Are you having any pain in your eyes at all?
No.
Okay, so I'm going to score her eye opening as a 4, which is spontaneously. And then I've also been looking at her verbal response when I've been asking questions. So her verbal response I'm going to score as a 5 as well, because she is oriented to time, place, and person. And then I'm going to check for her motor response. So Miss Dea, can you stand up for me? And then can you flex your arms out for me? And then flex them back down. And then flex your arms out this way and then back down. And then go ahead and move your leg out and then back in. And are you having any pain when you do those?
No.
Okay, go ahead and have a seat. Okay, so her motor response seems to be really well. She is obeying all the commands and she has no issues with that. So I'm going to score that as a 6. So she did score at a 15. So she is good to go on her Glasgow coma scale. So the next thing I'm going to check is her posture and her position. And just by looking at her, I can tell that she is sitting upright. She looks like she's sitting at a good posture. You can check for the discate. I can't pronounce it very well, but that's when her arms are to the core. And then the decerebrate, which is when her arms are going out. And then there's also flaccid. When you lift it up, you don't see anything, no muscle or anything like that. So just by looking at her, she does have normal posture and position. So the next thing I will be looking for is her general appearance. I can tell just by looking at her, she's dressed appropriately to the weather. It is rainy, a little bit chilly out. She's got a hoodie on. She's got appropriate shoe wear. She looks very well groomed. She looks very clean, and she looks like in her mood that her mood is appropriate for today as well. She looks a little stressed. We got exams tomorrow. So the next thing I will do is her vital signs. So I'm just going to verbalize those that I've checked all of her vital signs, her temperature, blood pressure, pulse, and oxygen. And then I will go ahead and do a pain assessment as well. So Ms. Dea, are you having any pain today?
No.
None at all. So if you had to rate pain at all, from a 0 to 10, with 10 being the worst, what would you rate your pain today?
0.
At a 0. Okay, so she's not having any pain, so we're good to go on to our next task. And our next task is checking the cranial nerve number 2, and we'll also be checking cranial nerve 3 and 6, which is our visual deficits. So I would have a pen light on me, which, hold on. So we're going to use this as my pen light, and I will be checking her eyes. So she will go ahead and take her glasses off for me so I can actually get a good visual, and I will turn my pen light on, and I'll just kind of make sure that I'm letting her know what I'm doing. So I'm going to put my hand like this in a C shape right around your eyes, and I'm just going to kind of move this pen light over. Okay. So just go ahead and look straight for me, and then I'll just look like this, and then I'll do it like this as well. And her eyes are good there. So then I will have her follow my finger. So just go ahead and follow my finger for me. Perfect. And Then to check for my accommodation, I'm going to go ahead and have her look for far away and close up. So I'm going to shine my pen light in your eye, and I just want you to go ahead and look up there in the corner for me, and then I'll have you look close up. So, okay, so go ahead and look up at the corner for me. Not. Okay, now look at my finger. Okay, and then look up again. Perfect. Okay, so she is Perla. The next test I'm going to do is cranial nerve number 8, which is the hearing. I'm going to check for any hearing deficits. We can do the whisper test, which is what I'll do today because I do not have a tuning fork. If I did have a tuning fork, you would just kind of bang it and then put it kind of close to her ear and just let her know when you don't hear the vibrations anymore. So I'm going to do a whisper test. I'm going to come up behind you and I'm just going to whisper 2 different things, one on each ear, and just let me know what I say, okay?
Okay. Soda. Potato chips.
Okay, she passed that. Okay, so the next test I'm going to be doing is checking for sensation. I believe that's cranial nerve 5. I'm going to be using this little doohickey here, and one end is soft and then the other end is sharp. I'm gonna have her close her eyes and I'm gonna have her let me know what she's feeling. I'm gonna check both sides of her cheeks and the top of her head. Okay, so go ahead and close your eyes for me and let me know what you feel.
Soft. Sharp.
Okay, other side.
Sharp. Soft.
Perfect. Okay. And then I don't have a monofilament on hand, but I would test for that too, and I would check that on the palms of her hands and the palms of her feet. Okay, the next one I'm going to test is her motor function, which is cranial nerve number 7. I would assess her speech, which that is something that I've already assessed for. Whenever I've had conversation with her in the beginning of our assessment, her speech is clear and she makes good sentences, so she's good to go on that. And then I'm going to check her trigeminal nerve, which is right here, and I'm going to have her make a couple faces for me. So can you smile for me, and then frown, and then puff out your cheeks? Okay, so she is even on both sides when she's doing those for me. And then to check for her trigeminal nerve, I'm going to place my fingers on her jaws, and I'm going to have her tighten her jaw and just move it side to side for me. Okay, so I'm going to put my fingers right here. Go ahead and tighten your jaw and then move it side to side for me. Perfect. And I'm checking for equalness, and then also if she's having some pain, she would verbalize that to me. The next assessment I would do is checking for her gag reflex and her ability to swallow. So that's in cranial nerve 9 and 10. So I will just have her swallow her own spit. I don't have anything for her to drink right now, so we'll just have her swallow and I'll just see how she does. So go ahead and swallow for me. Okay, and that was perfect. And then I would use a tongue depressant and I would have her open her mouth, say ah, and I'm checking for equalness on both sides, and then I would check her gag reflex with that as well. The next one I'm going to check is speech pattern or difficulties with cranial nerve 10. I would check for hoarseness in her throat. Do you have any hoarseness in your throat? And then can you verbalize the ah for me? And with your mouth wide open, say. And do you have any soreness or anything in there? Okay, perfect. Then I'm going to check her accessory function, which is cranial nerve 11. I'm going to place my hands on her shoulders, and I just want you to kind of shrug for me, and I'm gonna push down a little bit so you can kind of fight against me and resist. So go ahead. Perfect. And then I will place my hand on the side of her chin, and I will have her turn her head, and I'll be doing some resistance on that too to see how well she does with that. So I'm gonna place my hand on your chin and try to go this way. Perfect. And then the other way. Good. The next one I'll do is the hypoglossal, which is cranial nerve 12. I will have her protrude her tongue out and move it side to side. So I'll have you stick your tongue out for me and just kind of move it side to side. And I'm just checking to see if it's even, which it is. So now we're going to do a couple exercises. I'm going to check your gait, muscle tone, strength, and coordination. So first I'm going to check for flexion and extension. So go ahead and put your arms out like this, and then just kind of bring them up and then back down, and then go ahead and move your wrist down. I'm checking for pronation and supination. And then I will have her go ahead and stand for me, and you will close your eyes, and then go ahead and touch your nose, and then back down, and then other hand touch your nose, and back down. Okay, you can go ahead and sit down for me. And then we had said before that we're going to check for posture, which I can visually see her posture. She's sitting upright. She looks good with her posture. And then we'll check her muscle. We're going to look for atrophy. We're going to do some passive range of motion. So I'm going to take your arm here, and I'm just going to bend it this way and then bend it up this way. And I'm just checking that muscle, making sure that muscle's moving. And it's moving great. And then I'm going to go ahead and do your leg as well. So we'll lift it up, and then we'll bend it back down, just like that. Her legs are moving great. And then we are going to do grips and presses. So go ahead and grab my hands and squeeze them. Good. Okay, and then your feet, I want you to push down like you're pushing a gas pedal, and then push up for me. Perfect. Her grips and presses are equal. And then I will have you go ahead and stand up again. And I want you to run your heel down your opposite shin. Perfect. And then do the other side. Great. And then we're going to walk heel to toe. So just do about 5 and then turn around and do 5 more. Okay, and then I want you to walk 5 steps using your tiptoes. Great. Yeah, and then I would check her deep tendon reflexes in her wrist and her knees. And then our last thing that we would do would be our Babinski reflex. For the deep tendon reflex, 2+ is normal. And so for our Babinski reflex, I will take the palm of her foot, and you just go up in a rotating area, and you are checking to see if the toes contract and draw together. And you, like I said, you want to start at the heel and up to the toes. So that would be the end of the neuro assessment. Ms. Day here checks out perfectly fine. And that's it.